Lanka Hospitals has achieved yet another goal in their mission to provide a comprehensive range of medical services that is on par with international standards here in Sri Lanka. Their latest achievement is the setting up of a fully equipped facility to treat blood-related cancers, including bone marrow transplant. Dr. Saman Hevamana, who has extensively worked and studied in the United Kingdom, is possibly the only consultant specializing in Heamato Oncology here in Sri Lanka, who is also the head of the Heamato Oncology unit in Lanka Hospitals. Doctor, for the benefit of our viewers, could you tell us what is blood cancer and how many varieties of blood cancers are there?
Under blood cancers, there are three main groups, leukemias as the commonest and the one people generally refer to as blood cancer. There are two other types of blood cancers coming under hematology. One is lymphoma, those are originating from lymph nodes or from the lymphatic system. So lymphomas can come in lymph nodes or in lymphatics which runs parallel to blood vessels all over the body. So those are called lymphomas. The third one is myeloma. Sometimes people call it bone marrow cancer or bone cancer. So there are separate bone cancers. This is called plasma cell myeloma. That's the right medical term according to the WHO classification. Plasma cell myeloma, people call it myeloma, multiple myeloma. That is the third variety of blood cancer. This is a very oversimplified classification of blood cancers. Under each big heading, there are hundreds of different types of blood cancers. For instance, there are so many types of leukemias. Broadly, we say chronic leukemias and acute leukemias. Under each, there are so many subtypes, and it is an evolving field. So every year, every decade, there will be so many new names and reclassifications and differences in treatment in hematological cancers or blood related cancers.
What is bone marrow transplant treatment?
Bone marrow transplant treatment is a modality of treatment. It's one modality to basically prevent blood cancers recurring. So it's not a treatment for somebody having a blood cancer. So we do bone marrow transplants for leukemias, lymphomas, myelomas. For layman's understanding, there are instances where we transplant patients when the cancer is still active. So that's not the norm. That's in only in a minority of cases. Mainly bone marrow transplants are done for patients who are in remission. What we call remission means the cancer not to be seen, but it doesn't mean that it has completely gone. So we have to get a cancer, either myeloma, lymphoma or leukemia, to some sort of response, either to a complete remission or to a very good partial remission. That means it has to be controlled. Then we do a transplant with the idea of getting it under more control, plus to prevent it coming back.
You're saying bone marrow transplant treatment is only necessary after chemotherapy, when chemotherapy doesn't work?
Yeah, like at least he has to be in a good remission. What we say is the patient should have a chemo-responsive disease. So if there are a minority of patients with blood cancers who are not responding to chemotherapy. So there is no point transplanting those people. Important to understand early enough whom to transplant, whom not to transplant. There are so many different types of transplants and different types of blood cancers. So the most important decision in bone marrow transplant is the decision whether somebody need a transplant and also at what stage he need a transplant.
So what is the advantage of bone marrow transplant treatment?
Advantage of why we do transplants is, if we can't control or prevent blood cancer coming back after chemotherapy alone. The most important thing is to rightly diagnose a blood cancer. It's very important to know what type of blood cancer somebody has got. The treatment, the decision about transplant, long-term follow-up depend on the diagnosis. and secondly, it's very important to give the right treatment before transplant. For instance, if you give some sort of treatment, some types of treatment, you will never be able to transplant those patients. If you use some types of chemotherapeutic agents, we will never be able to harvest cells for transplants. So, it's important to give the right treatment to get somebody into a remission. Then the decision comes whether he needs a transplant. How do you decide about that is, we look at the chance of cure or chance of survival or chance of dying because of the cancer. Then we look at the chance of cure or chance of death because of the transplant. Transplant itself has a mortality, that's called transplant related mortality. So, we start from the starting point is somebody has to decide what is going to happen without treatment, without going for a transplant, without chemotherapy. If somebody has got acute leukemia, without treatment, the death rate is 100%. So, with treatment, if I say not with transplant, with chemotherapy, there is about 70% chance of living, then you take that chance. So, 100% death versus 70% survival or 30% death. So, that is a fair decision. So, we give chemotherapy. So, likewise, when you try to transplant after chemotherapy, you have to decide, somebody who knows about hematology oncology or blood cancers has to decide what is the probability, what is going to happen to this patient if I leave him alone. So, if there is a 100% chance of relapse or a 90% chance of relapse, then you have to see what can be done to prevent it coming back. In some instances, we give a treatment called maintenance treatment. There are drugs to keep it away. Sometimes we do bone marrow transplants. So, when you look at the transplant, have to again think what is the chance of getting this patient cured with the transplant and compare it with the chance of death or other side effects related to transplant. That is how the decision making process works. So, that the advantage is, okay, with the transplant you can make somebody cured from a blood cancer or prevent it coming back. So, that is the biggest advantage.
What makes Lanka Hospital's Heamato Oncology unit with bone marrow transplant treatment stand out from the rest of the industry in Sri Lanka?
Unique thing is about the setup of the kind of hardware. We have got a unit where we treat only blood cancers in Lanka Hospital. That unit may have patients belonging to different oncologies, but the unit, the rooms, the ward is only for treating blood cancers, and we have trained staff, nurses who will only care for patients who has got blood related disorders, whether it is leukemia, lymphoma or myeloma or something else, some other blood related disorder. This is only for blood related cancers and disorders. So, they have got specialized training to handle those patients, and also they have got specialized training to deliver chemotherapy and other supportive care. So, it is a very is a unique, very specialized in the way it works in developed countries. This is the setup they had in all the countries, all the hospitals in UK I have worked. They have dedicated hematology oncology units in national healthcare system in the UK, where patients with blood cancers are separately treated. We have I have worked in big hospitals where there are 30-40 bedded blood cancer units, so hematology oncology units. So, ours is a very small one, manned by trained nursing staff, dietitians, other supportive care staff, and by few consultants who deal with blood cancers.